When we refer to venous insufficiency, we're talking about a population of about 30 million adults in the U.S. that are affected by this condition. We're not talking specifically about varicose veins. I mean, patients with venous insufficiency may present with varicose veins. They may also present with just swollen, achy legs, with diffuse spider veins, with venous ulcers or leg ulcers that haven't healed. So venous insufficiency encompasses a much larger population than just what we generally think of as varicose veins. The procedures that we use to treat patients with venous insufficiency have changed dramatically since 2000. What's revolutionized or really opened the door to treatment for 30 million adults was the introduction of endovenous techniques of closing the greater saphenous vein or other leaking veins. This was introduced by Venous Medical Technologies in 1999, received FDA approval, and this was a radiofrequency-based catheter system where we, through a small needle, can insert this catheter as far down as the ankle, usually at the mid-calf. But this is done under local anesthesia with just a small amount of oral sedation, like a Valium or an Ativan. It takes less than an hour usually, and patients are back to their normal activities within 3 to 5 days, to be truthful.
Presented mostly after pregnancy. It just has worsened over the years.
How old is your child?
Oh, they're 15 and 13.
Oh, so you've had this for some time.
I've had this a long time, yeah.
How are you feeling, Pam?
I feel fine.
Any discomfort?
Nope.
Very good. So you got a 13 and a 15-year-old. Have you done anything else? Have you worn those compression stockings that they prescribed for you?
Yes, I've always worn them.
So you've been wearing compression stockings for a number of years then.
Right.
Do you find a lot of relief in those hose?
Yeah, sometimes.
Yeah. Did you find it was difficult to wear them given the climate down here? Were they warm in the summertime?
Yeah, sometimes it could be too warm.
What kind of work do you do?
I'm a nurse.
You spend a lot of time on your feet. That's the other risk factor.
I had gone for several consults before this, but afterwards just never had enough confidence in going and having any type of procedure done, and so consequently I just put it off, and fortunately I did, because they came out with the new procedure that Dr. Magnant does, and I opted to go with that and have been very pleased with the outcome.
I think the most important thing is to be evaluated by somebody who specializes and really is dedicated to the evaluation, not just the treatment, but the thorough evaluation, logical evaluation, formulate a logical treatment plan, and then expertly execute that plan, perform it with good technique.
There was really no recuperating time at all. I went in and had the procedure done one day, I was out of here in probably less than 30 minutes, and there were no restrictions.
When I walked into the office, I found it to be what I call very eclectic, especially for a doctor's office. So I found it very comforting. The whole environment's very comforting. The staff is excellent. I can honestly say I've not once hesitated in anything they've said or done. And I think the atmosphere of the office helps create that. It's like going to a spa. It really is, except this is not cosmetic. You know, mine was definitely not a cosmetic procedure. But that's what it feels like. It's a spa. Somebody's going to treat you really well.
I've actually had the ropey veins, the varicose veins, probably for 15 or 20 years. My family, my mother, my grandmother, my brothers and sisters, mine is basically hereditary.
I work out every day at the gym. I had to tape my leg up every day. I've been doing that for almost 4 years. At night it would ache and I'd have to tape it up, or the next morning it would swell.
The last 4 years I have not even worn shorts because I just thought that my legs just looked so bad. I do play tennis. I did have to wear tennis outfits, and I was a little self-conscious on the courts.
It was nice to know I wasn't going to have to go under a general anesthetic. That was very important to me. I have had 5 surgeries and I don't really do well with that. So it was very nice to know I wouldn't be doing that. The medication they give you before the procedure is very relaxing. In all of the surgeries I've had, this is the only one where I've never suffered pain except before I had it done. There was no pain after I had it done whatsoever.
My husband, who is a physician, had a patient of his come in and tell him about this procedure that she had done. And he was very interested, so he had me come for a consult, which I did, and I was very pleased with what I heard and decided to go ahead and have it done.
It takes, I think, patience and dedication of a group of people like we have here. Collectively, we refer to ourselves as vein specialists. That includes myself, a vascular surgeon, J.T. Jarrard, a registered vascular technologist, and the rest of the caring, compassionate, and professional staff we have here at Vein Specialists at Royal Palm Square. So that really, I've been asked the question before by others, is there a patient that you cannot help? And I ventured to say in the past, and I can say this with truth and sincerity now, that there has not been a venous patient that we've seen that we could not offer some measure of improvement to. Even the patients who have had 3 to 4 or 5 operations or procedures done in the past, with a good ultrasound by an expert and experienced technologist, we can find where the residual problem is and fix it, usually with a catheter-based system that is done, again, under local anesthesia in the office setting, usually in less than an hour.
I have no ropey looking veins, none of the bumpy veins anymore. My legs are now smooth, and the color is starting to disappear now, and it's like amazing. It's almost like a miracle. I would have never expected that to ever happen.